Welcome to Nourishing Health Beyond the Filter, the podcast where we break down the science of nutrition and chronic disease management without the fluff. I'm Kimmy Seuss, and today we're diving into an essential topic, the role of nutrition in managing end-stage kidney disease, or ESKD. Whether you're a healthcare professional, a caregiver, or someone navigating kidney disease yourself, this episode is packed with insights to help make nutrition work for you. We'll be covering key nutritional assessments, dietary strategies, and the latest research shaping ESKD management. Plus, we have a fantastic guest, Alejandra Dallas, a registered dietitian specializing in renal nutrition. Who will help us connect the science to real-life patient care. Stick around for practical tips you can start using today. So what exactly is ESKD? In simple terms, it's the final stage of chronic kidney disease, where the kidneys have pretty much checked out of their full-time job. And that comes with a host of nutritional challenges: malnutrition, muscle loss, and protein energy wasting, to name a few. Managing these effectively is critical for quality of life. Now, before we even talk about meal plans, healthcare providers rely on comprehensive nutritional assessments. This includes looking at dietary history, lab markers, and even body composition tests like bioelectrical impedance analysis. Basically, they're gathering all the puzzle pieces to create a personalized dietary plan. And trust me, in ESKD, one-size-fits-all diets just don't cut it. Thurlow et al., 2021, emphasizes that disparities in kidney replacement therapy access impact patient survival worldwide, underscoring why early detection and nutritional intervention are crucial. Once again, individualized care is essential. Nutritional therapy and dietary strategies, key therapy elements. All right, let's talk about food. Because if you're managing ESKD, diet is everything. Key strategies include boosting fiber intake to support gut health, reducing dietary acid load to ease kidney strain, managing potassium and phosphorus levels. These two electrolytes are critical. Potassium, if too high, can cause dangerous heart rhythms, while phosphorus, which accumulates in ESKD, can lead to bone disease and cardiovascular issues. Managing these appropriate dietary restrictions and cooking techniques, such as soaking or leaching high potassium foods, helps. Per Kupitzi et al. In 2018, limiting potassium intake to less than 3 grams a day is key. Meeting protein needs without overloading the kidneys. Research by Zha and Kwan in 2017 suggests non-dialysis CKD patients should aim for 0.6 to 0.8 grams kg a day, while dialysis patients need 1.0 to 1.2 grams kg a day to prevent protein energy wasting. Sodium reduction is also crucial. High sodium intake contributes to hypertension, fluid retention, and cardiovascular risk. Reducing sodium helps manage blood pressure and improve kidney function. This all sounds simple, right?
No.
Well, not so fast. Let's bring in our expert to break it down further. I'm thrilled to welcome Alejandra Dallas, a registered dietitian and renal nutrition expert. Alejandra, let's start with the basics. How are personalized nutrition strategies changing the game for ESKD patients?
Thank you for having me, Kimmy. The biggest shift we're seeing is moving away from generic renal diets and instead crafting plans that consider the patient's unique lifestyle, culture, and metabolic needs. When we personalize nutrition, patients actually stick with it, and that leads to better health outcomes.
That makes total sense. I mean, if someone told me I had to eat the same bland, low-sodium diet forever, I'd probably cry into my steamed vegetables. So, how do you balance patient preferences while still meeting nutritional needs?
Great question. Education is key. A lot of small, practical changes like soaking potatoes to reduce potassium or using plant-based protein strategically can make a huge difference without making food boring.
All right. Thank you so much, Alejandra. Now let's talk about the latest science. Recent research highlights a few major points. Dietary strategies significantly help manage hyperkalemia, which is high potassium levels. And this is cited by Capuzzi et al. In 2018. Protein energy wasting is a serious issue. 85.5% of dialysis patients meet malnutrition criteria per Akibi Bar et al. In 2024. Rehabilitation nutrition is emerging as a key intervention, integrating diet and exercise to combat muscle loss per Okumer et al. 2022. Sodium reduction is crucial in ESKD management. High sodium intake contributes to hypertension, fluid retention, and cardiovascular risk. Research suggests lowering dietary sodium can help manage blood pressure and improve overall kidney health. Alejandra, how do you incorporate these findings into daily patient care?
Well, we reassess patient nutrition regularly, adjusting plans based on the latest research. Physical therapists are becoming more involved in renal care, helping patients maintain muscle mass alongside dietary strategies. And when it comes to sodium, we educate patients on label reading, seasoning alternatives, and reducing processed foods to help manage fluid retention and blood pressure.
Awesome. Great points. Great points. Now let's dive a bit deeper into some additional findings that are shaping renal nutrition. Phosphate management. New research underscores the importance of phosphate binders for patients with end-stage kidney disease, ESKD. Studies show phosphate control can help reduce cardiovascular risk and improve long-term outcomes. Rutherford et al. 2023. This highlights the need for careful monitoring of dietary phosphorus, especially from plant-based sources, which can be tricky for patients on dialysis. Probiotics and gut health. Emerging studies suggest that gut microbiota plays a significant role in kidney health. Probiotics may have potential benefits for managing uremic toxins and inflammation in CKD patients. Baffetta et al. 2023. This could revolutionize how we approach diet, as probiotics could become a part of nutritional interventions to improve kidney function. Additionally, plant-based diets. A recent meta-analysis indicates that plant-based diets may reduce the progression of CKD and improve cardiovascular health. It's interesting to note that while plant-based diets can be high in potassium and phosphorus, there are ways to adjust them for dialysis patients. Smith et al. 2024. This brings up the need for personalized dietary planning. Vitamin D supplementation. Recent trials have been evaluating the benefits of vitamin D supplementation in CKD patients, particularly in relation to bone health and immune function. Some findings suggest that vitamin D might reduce the risk of cardiovascular events and fractures in CKD patients. Martin et al. 2023. However, balancing supplementation with kidney function remains a challenge, and further research is needed to establish optimal dosages. Alejandra, with so much evolving research, how do you stay up to date with the latest findings, and how do you ensure that these emerging trends are integrated effectively into patient care?
That's a great question to me. Staying informed is a critical part of my role, especially since new research. I rely on a few strategies to keep up to date. First, I subscribe to several key journals like the Journal of Renal Nutrition and Kidney International. These journals are fantastic for in-depth articles and clinical trials. I also attend conferences, both in person and virtually. These events are valuable for networking with colleagues and hearing firsthand about the latest developments from experts in the field. In terms of integrating research into patient care, it's all about a term approach. When I come across new findings, I often discuss them with our multidisciplinary team. This includes nephrologists, dietitians, physical therapists, and even pharmacists. We hold monthly case review meetings where we evaluate how new studies might affect our current treatment protocols. For instance, with the emerging data on gut health, we're starting to explore incorporating more probiotics into some of our patient plans, particularly for those dealing with uremic toxins. And of course, we're not just making broad changes based on research. We always tailor it to the individual. We assess each patient's specific needs, taking into account factors like lab values, comorbidities, and their personal preferences. For example, with plant-based diets becoming more recommended, we work with patients to adjust their diet plans, making sure they get enough protein and manage their potassium and phosphorus levels.
Okay, well, let's sum it up. Thank you so much again, Alejandra. If you or a loved one is managing ESKD, here are our key takeaways. Regular nutritional assessments are crucial. Personalized dietary plans focusing on potassium, protein, sodium reduction, phosphorus, and fiber can make a huge impact. A multidisciplinary approach, including dietitians, doctors, and physical therapists, leads to better outcomes. So here's some actionable tips. If you're navigating ESKD, try these steps. Ask your doctor about regular nutritional assessments. Advocate for a tailored meal plan. Your diet should fit you, not the other way around. And stay informed. Keep up the latest research and discuss
new findings with your healthcare provider.
I'm Kimmy Seuss, and you're listening to Nourishing Health Beyond the Filter. Until next time. Thank you. Yay!